Hi friends, good evening everyone, and it's me Dr. Lokendra, and please subscribe my channel and to get more and more knowledge. And today I am going to discuss about the diagnostic algorithm for HIV exposed infant less than 6 months according to WHO 2021 and NACO 2021 guideline. So our topic of discussion is diagnostic algorithm for HIV exposed infant less than 6 months. So let's discuss if the baby born to HIV infected mother, what we have to do first. Baby, any baby, born to HIV infected mother is known case of HIV and baby born, and what we have to do next. HIV infected mother. So at consider at birth or nucleic acid amplification test. Consider nucleic acid amplification test at birth or within 2 days or within 2 days of birth. Within 40 hours we have to do NAT, and as soon as possible start nevirapine. As soon as possible start nevirapine at dose of 2 mg per kg. 2 mg per kg per dose at birth and both nevirapine nevirapine and zidovudine if high risk. Zidovudine if we suspect high risk. If we suspect high risk, and we will discuss the high risk child in next slide. And start cotrimoxazole at 4 to 6 weeks of age, and this must be remembered because you will forgot. And cotrimoxazole should be started at cotrimoxazole at 4 to 6 weeks of age. After that, doing NAT, nucleic acid amplification test within birth or within 40 hours. Either it is positive or negative. If the NAT is negative or if the NAT is positive, there is only two possible. And if the NAT is positive, start ART without delay. Start ART and repeat NAT to confirm infection. And again we have to repeat NAT. Repeat NAT to confirm. Repeat NAT, nucleic acid amplification test to confirm the diagnosis, because there will be false positive result may come. And if the NAT is negative at first time, then HIV DNA PCR at 6, we have to repeat the test at 6 weeks. Repeat HIV DNA PCR at 6 weeks. 6 weeks means nearly 1.5 months. And start when we start the cotrimoxazole at 6 weeks, at the time we have to repeat the HNA DNA PCR. If the first NAT is negative, we have to compare like this. And after doing HIV DNA PCR at 6 weeks, we have two result, either negative or positive. If the positive, send whole blood sample for HIV DNA PCR. If the positive, send whole blood sample for HIV1 DNA PCR. Repeat HIV DNA and repeat HIV DNA PCR if positive. DNA PCR if positive. So we are repeating the test if they come positive, and if negative then repeat at 6 weeks, and if positive repeat at same time to confirm the diagnosis. And this is the protocol. And in negative we have to continue cotrimoxazole, cotrim, stop nevirapine at nevirapine at 6 or 12 weeks. At 6 or at the time we have started the cotrimoxazole. At the time we have to stop the nevirapine if the test is negative. HIV DNA PCR is negative. So remember like that. Otherwise you will forget. And after that, after continuation of cotrimoxazole, repeat HIV DNA PCR at 9 months. Repeat HIV 1 DNA PCR at 9 months of age. 9 months or earlier if the child is symptomatic. If symptomatic. And if the test is positive, then we have to again come to here, collect whole blood sample and send DNA PCR containing cotrimoxazole and confirm the diagnosis again. And exclusive breastfeeding and start ART and exclusive breastfeeding should be done for 6 months and till 2 years as normal we have been following. And if the test is negative, then continue cotrimoxazole. If the test is negative, continue cotrim till HIV excluded. Continue breastfeeding at least 2 years. Continue breastfeeding at least 2 years, followed by gradual stoppage over 1 month. Followed by gradual stoppage over 1 month. And to establish the definite diagnosis as 18 months or 3 months after cessation of breastfeeding, which is later by HIV antibody test. We have 3 rapid tests to confirm diagnosis. And at 18 months or 3 months after cessation of breastfeeding. After cessation of breastfeeding, do HIV antibody test. Do HIV antibody test to establish definite diagnosis. To establish definite diagnosis. So this leads to the end of the topic, and thank you so much. And if you didn't understand, please write on the comment. I will be clarify. Thank you.